Good afternoon, Nancy. I am Stephen, your attending nurse. How are you now?
Good afternoon, Stephen. I'm good. Thank you for asking.
Well, Nancy, I am here to replace your cannula, as it is not working. Nothing to be panic, it is quite common and is due to tissuing. Afterwards, I'll do the clinical observations.
All right.
Nancy, how you are feeling now?
Actually, nurse, I have got quite a lot of pain where the dressing is.
I'm sorry to hear that you feel pain. Other than that, are you feeling fatigued or nauseous?
I just feel tired, nurse. But not nauseous, or anything else.
Thank you for your information. First of all, I would like to inform you that the pain you are suffering is normal, and I can reassure you that it is temporary.
Okay.
Moreover, we have already administered pain relief medication for you. But it requires some time for the full effect. In case your pain persists, I will speak to the doctor about additional pain relief. I hope you understand my words.
Yes, I do. Actually, nurse, I think I probably need some extra pain relief, so it would be great if you could speak to the doctor.
All right, I will speak to the doctor.
Well, nurse, I thought the doctor would have been here to see me already, to tell me how the operation went.
Yes, you are right. The doctor is about to visit you once you have been settled on the ward, after the clinical observations. During his visit, he will give details of the operation and discuss the recovery analysis.
Okay, that's fine then.
Nancy, the cannula needs to be replaced before the doctor's visit. Currently, your cannula is not working due to tissuing. It is very important to continue the antibiotic treatment in order to prevent the infection, and also to maintain your hydration status.
By the way, nurse, I really don't understand why the cannula has stopped working.
Your question is reasonable. The cannula is not working because of tissuing of the cannula. For your better understanding, I will explain it to you. Tissuing of cannula generally means leakage of intravenous fluid into the surrounding tissue. This is caused due to several reasons. One of the reasons can be the accumulation of fluid, resulting in the spill of fluid. Another cause can be the patient moving around, causing the change in position of the cannula. The next reason can be due to the vein's fragile nature. As a result of this issue, you are not receiving sufficient intravenous fluid. I think it is clear to you. May I know if you have any other concerns that need to be addressed?
Yes, nurse, the tissuing of the cannula is quite understood. However, I would like to know why I can't just be given tablets instead of having another cannula inserted. It will be more convenient, isn't it?
Your thoughts are quite natural. I can explain why a cannula is essential in this condition. For that, I would like to inform you of some of the advantages of delivering antibiotics via cannula. While using a cannula for antibiotics administration, it is being directly injected into the bloodstream, whereas an oral tablet needs several processes to reach the bloodstream, from where it carries to the different parts of the body. That means the process requires less time than oral, and is faster acting too. In addition, it is more effective for infection control. Is it clear to you now?
Yes, nurse, I got it.
Nancy, I would also like to notify you that your antibiotics are likely to change to oral medication form in a few days after you have made satisfactory progress. However, in the present scenario, IV antibiotics are very essential to keep you safe.
All right. That's fine then.
Thank you for your understanding, Nancy. Can I have your consent to replace the cannula and do the clinical observations?
Yes, you may please proceed.
Thank you for your consent.